Good day everyone, I am Judy Anmao, the third presenter of Group 6, and my report is all about motor disorder under the neurodevelopmental disorder. What is motor disorder? Motor disorder are neurological conditions that cause problems with movement such as increased movement that can be voluntary or involuntary, decreased or slow voluntary movement. There are many types of motor disorders. The common types include developmental coordination disorder, stereotypic movement disorder, and the tic disorders. So first, the developmental coordination disorder or DCD. Developmental coordination disorder, or they call it dyspraxia. It is a common neurodevelopmental condition that affects movement and coordination. In prevalence of DSM-5, developmental coordination disorder in children ages 5 to 11 years is 5% to 6%. In children aged 7 years old, 1.8% are diagnosed with severe developmental coordination disorder and 3% with probable developmental coordination disorder. Males are more often affected than females. Common co-occur with DCD includes speech and language disorder and specific learning disorder, especially reading and writing. Children who have DCD frequently have other childhood disorder. The most frequent coexisting condition with DCD, about 50% co-occurrence, is the ADHD or the Autism Spectrum Disorder or specific learning disabilities. The diagnostic criteria of DCD in DSM-5, Criterion A, young children may be delayed in achieving motor skills like sitting, crawling, or walking. They also may be delayed in developing skills such as buttoning shirts, completing puzzles, and using zippers. These difficulties are manifested as clumsiness. In Criterion B, the motor skills deficit in Criterion A significantly and persistently interfere with activity or daily living. Examples of such activities include getting dressed, eating meals without mess, engaging in physical games with others, using specific tools in class such as rulers and scissors, and participating in team exercise activities at school. Criterion C states that the onset of symptoms of DCD must be the earlier development period. However, DCD is typically not diagnosed before age 5 years old because there is considerable variation in the age of acquisition of many motor skills or lack of stability of measurement in early childhood. In Criterion D specifies that diagnosis of DCD is made if the coordination difficulties are not better explained by the visual impairment or attributable to neurological condition. Thus, visual function examination and neurological examination must be included in the diagnostic evaluation. The causes of DCD includes being born prematurely before the 37th week of pregnancy, being born with a low birth weight, or having a family history of DCD, although it is not clear exactly which genes may be involved in the condition, the mother drinking alcohol or taking illegal drugs while pregnant. Treating DCD. There's no cure for DCD, but a number of therapies can help children to manage their problems. This includes being taught ways of do activities they find difficult, such as breaking down difficult movements into smaller parts and practicing them regularly, adapting tasks to make them easier, such as using special grips on pens, pencils so they are easier to hold. Although DCD does not affect how intelligent a child is, it can make it more difficult for them to learn, and they may need extra help to keep up at school. The second type of motor disorder is the stereotypic movement disorder. Stereotypic movement disorder is a condition in which a person engages in repetitive, often rhythmic, but purposeless movements. In some cases, the movement may result in self-injury. Stereotypic movement disorder have current severity, mild, moderate, and severe. In mild, symptoms are easily suppressed by sensory stimulus or distraction. Moderate, symptoms require explicit protective measures and behavioral modification. Severe, continuous monitoring and protective measures are required to prevent serious injury. Morbility of SMD in DSM-5 may occur as a primary diagnosis or secondary to another disorder. When stereotypic movement disorder co-occurs with another medical condition, both should be coded. Prevalence of SMD, simple stereotypic movement like rocking, are common in young typically developing children. complex stereotypic movement are much less common. Between 4% and 16% of individuals with intellectual developmental disorder engage in stereotypic and self-injury. The risk is greater in individuals with severe intellectual disabilities. Among individuals with intellectual disability living in residential facilities, 10% to 15% may have stereotypic movement disorder with self-injury. What are the symptoms of stereotypic movement disorder? The repetitive movements that are common with this disorder include rocking, banging in the head, self-biting, nail-biting, self-hitting, picking at the skin, handshaking, or waving. What causes of stereotypic movement disorder? The cause of stereotypic movement disorder is not known. However, the movement tend to increase if the person is stressed, frustrated, or bored. Some things which have been known to cause the disorder are certain physical conditions, head injuries, and use of some drugs such as cocaine. Treatment for stereotypic movement disorder. The goals of treatment for children are to treat any injury due to the behavior and to ensure the child's safety, as well as to improve the child's ability to function. The most common treatment approaches used for children with this condition are therapies aimed at reducing stress that may trigger the movement and changing the behaviors. A behavioral therapy approach known as differential reinforcement of other behaviors, or DRO, aims to reward socially appropriate behaviors. Another behavioral approach called Functional Communication Training, or FTC, teaches and rewards the person for using alternative responses or verbal strategies to replace stereotypic movement when they are aware that they need something or are feel distress. The third disorder is the tic disorder. Tic disorder. A tic is a sudden, rapid, recurrent, non-rhythmic motor movement or vocalization that people do repeatedly. People who have tic cannot stop their body from doing these things. For example, a person might keep blinking over and over, or a person might make a grunting sound unwillingly. There are three types of tic disorder are included in DSM-5. First is the Tourette syndrome. Second is the persistent chronic motor or vocal tic disorder. And the third is provisional tic disorder. The diagnostic criteria of Tourette syndrome or disorder. A person both multiple motor and one or more vocal tics have been present at some time during illness, although not necessarily concurrently. Criterion B. The tic may wax and wane infrequently but have persistent for more than 1 year since first tic onset. Onset is before age 18 years old. The disturbance is not attributable to the psychological effects of a substance, example is cocaine, or another medical conditions. The second tic disorder is the persistent chronic motor or vocal tic disorder. In criterion A, single or multiple motor or vocal tics have been present during the illness, but not both motor and vocal. Criterion B, the tic may wax and wane in frequency but have persisted for more than 1 year since first tic onset. Criterion C, the onset of this disorder is before age 18 years old. Criterion D, the disturbance is not attributable to the psychological effect of a substance, example is cocaine, or another medical condition. In criterion E, criteria have never been met for the Tourette syndrome or disorder. The third tic disorder is the provisional tic disorder. A person must have criterion A, single or multiple motor and or vocal tics. Criterion B, the tics have been present for less than 1 year since first tic onset. Criterion C, the onset is before age 18 years old. Criterion D, the disturbance is not attributable to the psychological effect of a substance, example is cocaine, or another medical condition. Criterion E, a criteria have never been met for Tourette syndrome or persistent chronic motor or vocal tic disorder. The prevalence. Tics are common in childhood, but transient in most cases. The estimated prevalence of Tourette's disorder ranges from 3 to 8 per 1,000 in school-aged children. Males are more common affected than females. Comorbidity of tic disorder. Many medical and psychiatric conditions have been described as a co-occurring with tic disorder, with ADHD and obsessive-compulsive and related disorder being particularly common. The obsessive-compulsive symptoms observed in tic disorder tend to be characterized by more aggressive symmetry and order symptoms and poorer response to pharmacotherapy with selective serotonin reuptake inhibitors. Children with ADHD may demonstrate disruptive behavior, social immaturity, and learning difficulties that may interfere with academic progress and interpersonal relationship and lead to greater impairment than that caused by a tic disorder. Individual with tic disorder can also have other movement disorder and other mental disorders such as depressive, bipolar, or substance use disorders. Other specified tic disorder or OSTD. Diagnosis assigned to individuals who are experiencing symptoms of tic disorder which cause distress or impair social, educational, occupational, or other vital areas of functioning. The OSTD diagnosis is used when the symptoms do not meet the complete diagnostic criteria for another type of tic disorder, or when the clinician chooses to specify the reason the diagnosis criteria are unmet. Unspecified tic disorder. This category applies to presentation in which symptoms characteristic of a tic disorder that cause clinically significant distress or impairment in social, occupational, or other important areas of functioning predominate but do not meet the full criteria for a tic disorder, or for any of the disorder is the neurodevelopmental disorder diagnostic class. The unspecific tic disorder category is used in situations in which the clinician chooses not to specify the reason that the criteria are not met for a tic disorder or for a specific neurodevelopmental disorder, and includes presentation in which there is insufficient information to make a more specific diagnosis. That's all for my presentation. Thank you.